NHS England has declared a major incident over the coronavirus outbreak, asking hospitals to open new wards to treat infectious diseases. As the government unveiled its battle plan, warning that a fifth of workers could be off work at the outbreak's peak, 12 new British cases emerged today, having arrived here from Italy, Germany, Singapore, Japan and Iran. There are now 51 cases in the UK. A total of 13,911 people have been tested. 12 people have been discharged from hospital. No one in the UK has died from the virus. In a moment, we'll hear from the Health Secretary, Matt Hancock. But first, here's our health correspondent, Victoria MacDonald.
They have a plan, all 27 pages of it, outlining what they are doing for coronavirus and what they will do should it become an epidemic.
I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority.
Flanked by the Chief Medical Officer and the Chief Scientific Advisor, the Prime Minister was seeking to reassure the UK public that all was well and their carefully washed hands.
There's been a bit of confusing advice about things like shaking hands.
Yes.
And I'm intrigued to know whether you've developed a personal policy yourself. So next time there's a visiting dignitary and you're standing on the doorsteps of Downing Street, are you going to shake their hands? And if not, how are you going to avert an international incident?
No, well, Victoria, I can tell you that I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
Mr Johnson had visited the Royal Free Hospital in North London on Sunday, where they are treating some COVID-19 patients. Downing Street later clarified that he hadn't actually shaken their hands. Tonight, though, it has emerged that the NHS has now declared a major or level 4 incident. In a letter sent from NHS England, hospitals have been asked to find extra areas that can be modified to treat those who need infectious disease care. That's in addition to the specialist units. And that they should identify how to increase their critical care and high dependency capacity. Today, the numbers infected here increased again to now 51. How far it will spread, of course, is not known. Experts say a worst-case scenario could be 80% with 1% dying, but that the majority of people will have mild or no symptoms. There are 4 parts to this coronavirus plan. There's contain. That's where we are now, tracing all cases. Then there is delay, trying to push the peak out of the winter season so the NHS can cope better. Research. That is already happening, looking for vaccines and treatments. And then there is mitigate. That's when the epidemic has taken hold and they have to look at other measures that could include school closures or calling in the army. Once it gets to the mitigation phase, the plan says that some non-urgent care may be delayed to prioritise and triage service delivery. Staff rostering changes may be necessary, including calling leavers and retirees back to duty. And that may need new laws. While in Scotland, the plan states health boards can apply for court orders for quarantine and medical examination of those suspected to have coronavirus. At worst, the plan says, 1 in 5 employees could be absent from work. And that is a scenario doctors' surgeries are preparing for, staff falling ill or having to take time off if schools do close. In that case, this GP practice will use Skype calls for consultation.
Yeah, that's fine. Do you mind just telling me briefly what it was for?
They also have an isolation room should a patient come in, ignoring the advice to ring 111.
If our workforce diminishes, we will reshape and do our best to provide service. We'll need to prioritise and stream and keep the essentials going, ensure people get the medications they need, people who are acutely unwell are seen. But some of the routine stuff may have to go onto the back burner for a bit. But general practice in the UK, incredibly well set up to manage and cope with this sort of epidemic if it arrives.
Much of today's plan is about protecting the most vulnerable in society, the elderly and those with underlying health conditions, and also being prepared for what may well be coming our way.
Victoria MacDonald reporting there. Well, let's go over now to our political editor, Gary Gibbon in Westminster. Gary. Interestingly, some voices in Whitehall today saying about the government's full appearance on the stage today, about time too. I'm told by some who'd been in the room with Boris Johnson in earlier meetings that he'd had a real worry and anxiety that going public with announcements like this would create more chaos than the virus itself potentially. Well, the government has definitely moved into a different mode now, and you're going to see more of it very soon, I think, with more public health information, advertisements, online activity, and all the rest of it. It's worth just taking on board the scale of what the government is doing here. It's hard to think of peacetime precedent for the sort of powers they're talking about, as Victoria was saying there, the idea of the army coming in to replace the police. The scale of mortality here, at the worst end of the scenario, we are talking about hundreds of thousands of deaths that might not otherwise have happened. Very much the worst end of the scenario, and the government feel that there could be more data coming in from China, for instance, that will prove that wrong. But it means that in Whitehall at the moment, they are sitting there working out how you deal with that many deaths. Even some committee, I was told, looking at how do you prioritise people who want need their dead to be buried quicker than others. All sorts of other work going on in there. We know that the Health Secretary mentioned that sick pay might have to be looked at for people on zero contracts. I'm told there was one meeting where they talked about postponing the local elections in May. Boris Johnson said, for the moment it's business as usual, but we could soon all be living in the extraordinary scenarios that have been pushed around tables inside Whitehall until now.
Thanks, Gary. Well, in the United States, the Federal Reserve has cut interest rates by 0.5 percentage point in a bid to shore up the economy and financial markets amid all the coronavirus panic. But the surprise move has got a mixed review from investors. Shares in the US initially rose, but then fell back, dropping 500 points at one stage. Our business and global trade correspondent Paul McNamara is here. Paul, what's the thinking behind this move?
Well, essentially, stop the bleeding after more than a week of markets tanking and trillions being wiped off global markets, and lots of people sitting around at home thinking, am I worth less? But now the bigwigs at the US Central Bank have said, do you know what? It's not just abstract numbers now on the stock market that are going down. We're starting to see an impact in the real economy. So in travel, in tourism, and in sections of manufacturing that rely on parts coming in from China. And the truth is, they don't really know where this will end, because when they made the announcement, they spoke of evolving risks from the virus. So put all that together, they decided they need to do something.
And has it worked? I mean, has it worked well?
Well, in short, no. For 5 minutes it did, and then markets carried on tanking. Some investors seem to have thought, wait a minute, this move is so swift, the cut is so big, what the hell do the Federal Reserve know that we don't? So instead of injecting a bit of confidence, it's actually made some people more nervous. Some saying, do you know what, it's not a cut in interest rates that's needed, a cut in the cost of borrowing, which can take a bit of time to seep through to the economy. What they think is needed is a cut in taxes. So people at home have more money in their pocket right away, they can start spending right away, it will boost the economy immediately.
And what is happening here in the UK?
Well, some investors think the Bank of England might follow suit. Today, Mark Carney, the Governor of the Bank of England, was talking to MPs. He said that coronavirus could deliver a large economic shock. But of course, interest rates are already really low here, at 0.75%. There's not a lot of wiggle room. You've seen in the US, it's not really had that much of an effect. So attention could start swinging to the government, to the new Chancellor, Rishi Sunak. If he's going to do anything, we'll see what it will be next Wednesday when he gives his first budget, in not the best of circumstances.
Paul McNamara, thanks very much. Thank you, Chris.
Well, earlier I spoke to the Health Secretary, Matt Hancock, at the Department of Health. And it's coming up now, I hope. How worried are you? Are you losing sleep?
Well, it's my job to worry about these things. And as Health Secretary, when there's a major outbreak like this, then obviously I worry about it and take the action that's necessary to protect the public. And I understand why why members of the public are worried about it. Of course, it's only natural. So the plan that we've published today is being done to be as transparent as possible about the actions that we might have to take. These are actions we might have to take, not that we definitely will. Because if we do have to do some of these things, which are pretty unusual for a government to have to do, We want people to know that it's part of a plan, that it's led by the science, incredibly important that it's led by the science. Today, we are not asking people to do more than wash your hands. If you have a sneeze or a cough, catch it and follow the public health advice if you travel.
So if it's led by science, will it be the scientists who decide when to go to the next level? I mean, how will that decision be taken if you decide to start closing schools or whatever it might be?
Well, those decisions will be taken by the COBRA meetings. There's now a regular drumbeat of COBRA meetings, and the scientists are at the table, and they'll make their advice clear and very straightforward.
But is that based on thresholds of cases? You know, is it once we get to 1,000 cases, then we need to do something more? Or is it something else?
It's based on a judgment taking that into account, also taking into account the steepness of the curve, how rapidly the expansion of this virus is going, and what other countries are doing. Judgment will be made by the 4 CMOs of the UK, and that will be a recommendation to COBRA, but it's essentially that science-led decision, yes.
If it does take off and grips the population, the big crisis immediately is going to be a shortage of beds in hospitals, isn't it? I mean, what's going to happen when intensive care units are full and hospital wards are full?
Well, the good news about this virus is that the majority of people, about 4 in 5, we think, get mild symptoms, so a bad cough, basically. But of course, there's people who get much more serious symptoms. And the task of the NHS, especially in that peak phase, because this is a new virus, none of us have the natural antibodies, and so therefore, if it becomes widespread, it will hit a lot of people at once. Of course, that will be a big challenge for the NHS, and things in that situation may have to be done differently. For example, more treatment at home than we would have in normal circumstances.
But I was just with a doctor who was saying that the big worry on his mind is intensive care. You know, that intensive care is often quite close to capacity anyway. If it's suddenly filled with coronavirus patients, doctors are going to have to start making some awful decisions about who gets treatment and who doesn't.
Well, doctors do have to make that sort of decision all of the time.
Yes, and it'll be more acute, won't it?
Well, naturally, when there's more pressure on the NHS, those are decisions, operational decisions, that senior doctors always have to make, especially at times of pressure. But thank goodness we've got the NHS, because that means that everybody knows that the system, society as a whole, if you like, will be doing everything we can to help people according to clinical need, not according to any other consideration.
Obviously, you're trying to manage public fear, and you don't want panic to spread. And the numbers of people who would be likely to die in a mass infection are still relatively small, even at 1 to 2%. But according to age groups, it really changes, doesn't it? With the older people, you're talking about possibly 1 in 7 people over 80 dying. I mean, that's a very shocking statistic for older people and very frightening.
Well, of course I understand why people are worried. This is why we're doing everything we can to contain this disease. There are some things that are highly effective in terms of reducing the spread of the virus, but not very costly in terms of the disruption, like washing your hands. So we should be doing those. There are other things where we can make a targeted approach that supports, for instance, elderly people, people with underlying health conditions. We're not asking people to do this now, but should we need to, thinking about self-isolation for people, not because they have the disease, but in order to protect them from getting
So if you're
the
over
disease.
80, just self-isolate anyway once this takes off.
That is not what we're saying now, because the timing issues are really important. But you can see how that might be the sort of thing that would have a big positive impact. Likewise, we're doing a lot of work on making sure that people who are in care homes, who are often vulnerable and elderly, the care homes and the social care system gets the support it needs.
There are some pretty grim practical implications of this, though, aren't there, in terms of the number of deaths? I mean, you know, there have been reports of Hyde Park being turned into a morgue. I mean, is that correct?
Well, that isn't something that I've seen. It's we're working with local councils, local resilience forums, as they're called, to make sure that all of these eventualities are looked into and that we're prepared. The reasonable worst case scenario is obviously if all of the things go wrong, if the rates of infection are the highest that the scientists estimate they could be, and the impact of that as bad as it could be. We do that to make sure we're ready for, and we've got plans for anything that this virus can throw at us. But of course, we're working incredibly hard to try to stop that from being the outcome and trying to protect people. Delay
is the key part of your strategy, trying to delay whenever this becomes really big out of the winter period. Well, how can you actually do that? I mean, this is a disease.
Yeah, delay is the next part of the phase. Should we fail to contain? Now, the actions that we're taking during the contain phase, which we're in now, are also helpful to delay, especially washing your hands, and then when we do find a positive case, making sure that all of their contacts are themselves contacted and tested to try to stop the spread. So the delay phase includes that, but it also includes considering some of the much bigger options that have much bigger disruption, for instance, to do with mass participation events. If this virus goes through the whole population, but does that all at once, then clearly the impact, both on the NHS and on normal life more broadly, will be very, very significantly impacted during the peak because so many people will be ill at once. If that happens over a longer period of time, then although it's longer, we're better able to cope as a society, and we think that there's a good chance that in the summer this will have less impact because you don't have the other communicable diseases.
Matt Hancock, thank you very much.
Thank you.
Well, despite today's government announcement, there's still a lot of confusion about what to expect if the outbreak does get a lot worse and how to protect ourselves and those who are most vulnerable. With so many questions and precious few answers, our North of England correspondent Claire Fallon has been in Merseyside asking people there what they make of it.
The printouts say only 2 bottles each. The empty shelves say, even with rationing, supply can't keep up with demand. So far at least, the clamour for anti-bac gel is the most visible sign of the steps being taken by some. But for now, for many, life is as it was before, with little expectation that will change.
I'm not worried. We're not doing anything differently. I think it's all being blown out of proportion massively.
If things escalate anymore, is the potential of getting people to work from home, for example, is that practical for you?
No, not at all. Can't work from home. We got to come in here. I think people will continue to come in. I don't think it's going to. I don't think it will affect business.
I think we are more likely to catch it because so many people come in the shop. So.
Yeah.
On the day the next steps in slowing down the spread of coronavirus were laid out, in Liverpool, we did find some evidence of growing concerns, like the hand gel next to the magazines in waiting rooms, and what Frank told us about the steps being taken at his local church.
As part of the Mass, we have a greeting of peace when we all shake hands. So we're not going to do that anymore, and we're not having a communion wine for the duration of this crisis.
In his 90s, Frank knows he's in an at-risk group, but he says he won't hide away to avoid the virus.
Used to be, keep calm and carry on. I think it's keep calm and wash your hands now.
In an age of repeatable mantras, you know the ones. Keep calm and wash your hands might just become a thing. But with more cases will come more extreme steps. Retired health workers like Fiona may be asked to go back to work.
Well, I would have reservations because I am over 60 and, you know, they have said that obviously the over 60s are more vulnerable, so I would have concerns. But yeah, if they really needed people, you know, on the front line, yeah, I would go.
According to Dr. John Coakley, in reality, a relatively small number of ex-medics would be of use. Since he retired, he told me, from IT systems to medical techniques, it's all changed.
I wouldn't feel personally safe and I certainly don't think patients under my care would be safe in an environment I haven't set foot in for 5 years. I'd be very happy to go back in a sort of advisory or supportive capacity. It's just I wouldn't be much use as a doctor.
Business as usual, for now at least. But we're warned coronavirus and the steps to slow its spread mean for most of us, life will change.
Well, with me now is Professor John Edmonds from the London School of Hygiene and Tropical Medicine. He's involved with mapping the spread of infectious diseases. Thanks very much for coming in. There is no doubt that there's a growing sense of seriousness around this now. The NHS has declared coronavirus a level 4 incident, and that doesn't happen very often, does it?
No, and but this is, if we're right, the indications for this virus are that this could be a very serious incident, much more serious than we've had for many, many years.
And you heard the Health Secretary talking about how they're monitoring the sort of steepness of the curve, how this virus is progressing. What is your modelling showing?
So we're looking at what might happen into the future over the next few months, and we're looking at mitigation strategies, so just the sort of things that he's been talking about. So how effective might they be at slowing down this epidemic and reducing the peak and making it more manageable for the health service and community in general.
And how optimistic is that picture?
I think if we follow the advice when it comes out, and it's not for now, it will come in the coming weeks or months, you know, if we follow the advice carefully, and we will all have to do it, that's the important thing, because if people don't follow the advice, then it will have an effect on everybody. So if we all start to follow the advice properly, then it should slow the epidemic right down. I mean, you can see the effect that it's had, that these sorts of strategies have had in Wuhan in China. It has stopped the epidemic there, and it was really raging at one point. Now, we're not going to do anything anywhere near as stringent as that, but nevertheless, we can almost certainly slow the epidemic down so it doesn't put so much pressure on the health service.
The government is talking about this policy of containment. At what point, what numbers, does it suddenly think, well, we're losing the battle to contain, we now have to change strategy to delay?
Yeah, you don't just take one isolated measure. So you wouldn't just take the numbers of cases and say, OK, we've lost now. I mean, you take a lot of different measures. So you'd look for the fraction of cases that are not linked to anything else. That's one of the important indicators. You can look at genetic sequence data to see how related the different cases are and so on. So there's a number of different indicators that would be used to imply, OK, we're in the next phase now.
But in terms of whether the NHS can cope, when, you know, Matt Hancock talked about the worst possible scenario, how worried are you?
So the worst possible scenario is very bad. There's no question about that. But we can manage it. You know, so we can, as I say, but it's not for the NHS to manage it primarily. Yes, they would be busy trying to manage it. It's for all of us to help manage it.
And the Prime Minister insists that he's still shaking hands. Should he be?
I think now the risk is pretty low of those sorts of things, quite honestly. There are cases here in this country. There's probably more that we haven't identified yet. But, you know, there's 60 million of us that we've identified 50 cases. So, you know, the risk at the moment is low. Yeah, that's the whole point of this phase, is trying to keep the risk as low as possible, try and slow the epidemic as much as possible. And that's probably working. Later on, then, you know, in a month or 2 months' time or so on, there will be far more cases, and then it will be much more important to take those kind of strategies.
Professor John Edmonds, thanks very much.